Hi everybody, in this video we are going to discuss about the pathogenicity and treatment for the disease called as the amoebiasis. We are discussing about the disease amoebiasis, and this disease is caused by a pathogen or a microorganism which we call it as what? Amoeba histolytica. Amoeba histolytica is the pathogen. It is a protozoan which is causing the disease called as amoebiasis. Okay, Amoeba histolytica. So here this particular pathogen, okay, is attacking the major part of our digestive system, that is the large intestine. So it is there present in the large intestine, destroying the cells of the large intestine. So Amoeba histolytica is causing a disease called as what? Amoebiasis. Okay, amoebiasis. Now in this video we are going to discuss how it is causing this disease, pathogenicity. Okay, how it affects the organs or the parts of the organ we are going to discuss now, especially the digestive system. So here, if you are seeing, already we said that one of the stage of the Amoeba histolytica is what? Trophozoid. Okay, trophozoid. Now this trophozoid, as it enters inside into the digestive system through the contaminated food and contaminated drinking water, it enters through the mouth, through the esophagus into the stomach, and from the stomach it enters into the small intestine. From the small intestine it enters into the large intestine. There, in the large intestine, it releases one important proteolytic enzyme. We said it is releasing one proteolytic enzyme. That proteolytic enzyme is what now? Histolysine. Histolysine is a proteolytic enzyme. Now histolysine now starts destroying the large intestine cells. What are those cells? Of the submucosa. Okay, submucosa and mucosa will be destroyed now by the trophozoites, releasing by what? An enzyme called as histolysine. So histolysine now penetrates into the or destroys the mucosa and submucosa of the large intestine. Mucosa and submucosa of the large intestine. So here what we are saying, release of histolysine by what? We know that it is trophozoid, will now cause ulcers in the submucosa. Here ulcers means what? Just like a small wound. Okay, there will be sore or there will be destruction of these layers, mucosa and submucosa, which we are calling it as what? Ulcers. We are calling them as ulcers. So histolysine will cause what? Ulcers in the submucosa of the large intestine. This is in the large intestine. Please remember, it is in the large intestine. So once it causes ulcers, there what will be accumulated in that area? There will be cell debris, all the destroyed cells of the tissue or the organ. Okay, there will be cell debris, destroyed cells, and there in that ulcers we also see that there will be accumulation of RBC cells, and moreover there will be also lymphocytes present in the ulcers. Lymphocytes present in the ulcers will be seen. So these lymphocytes present, okay, in that submucosa, okay, in the submucosa. These lymphocytes helps in providing what? The immune power or immunity. These lymphocytes are playing an important role in what? Immunity. In immunity they will be playing a crucial role. Okay, they will be playing a crucial role. So they will try to attack what? This pathogenic organism. Okay, this pathogenic organism. So all these we are seeing now inside the ulcers. Inside the ulcers what we are seeing? Cell debris will be there, RBCs will be there, lymphocytes, which are very important in the immunity or immune system, they are there present in the ulcers now. And now what happens is that because of the presence of all these, okay, different types of materials like cell debris, RBC cells and lymphocytes, it now it will be forming abscesses. Abscesses means what? It is the pus that is formed. Okay, pus that will be formed. So what is this pus consists of? This pus consists of nothing but the cell debris RBC and the lymphocytes that are trying to attack the pathogen that is present and causing the ulcers. So all these will now help, they will be leading to the formation of what? Abscesses. Abscesses means nothing but pus that is formed, and because of that, there will be, that individual will go for stools with blood and mucus. That particular individual will be going for stools with blood and mucus. Okay, blood and mucus. So here, that now we have to remember, in the disease amoebiasis, that particular individual will be going for the fecal matter which is consisting of what? The blood and mucus. That fecal matter we are also calling it as what? Stool. We are calling it as stool. So stools with blood and mucus will be observed in the patients or in the persons who are infected with what? Amoebiasis disease. Caused by which organism? Amoeba histolytica. Caused by Amoeba histolytica. So this is very important. This is the identification. This is the point of identification to understand that he or she may be suffering with what? Amoebiasis. How do you say that they are suffering with amoebiasis? The stools will be with blood and mucus. Then we can say that particular person is suffering with what? Amoebic dysentery, or otherwise we are calling it as amoebiasis. So this is the name that we are using now, amoebic dysentery. So we are saying here that release of histolysine, okay, causes what? Ulcers in the submucosa, and that because of that there will be cell debris, RBCs and lymphocytes in the ulcers, and because of these cell debris, RBCs and lymphocytes in the ulcers, it causes what? Formation of abscesses, means what? Pus we say. And now because of that particular individual will go for the fecal or stools with what? Blood and mucus, which indicates that particular person is suffering with amoebic dysentery. We say that it is amoebic dysentery or tropical dysentery we call, or otherwise intestinal dysentery we call it as. Intestinal dysentery we call it as. Now this is the clear cut information about amoebiasis. But in severe cases, it may also affect other organs in our body. Please remember that. It may also affect other organs in our body. Amoeba histolytica, in severe cases, it may also affect other organs in our body. The primary part of the body which is causing amoebiasis is the large intestine. So here we can say that this is what? The large intestine it attacks, causing amoebiasis. But in some cases, this Amoeba histolytica, okay, the Amoeba histolytica may travel through the blood, okay, and now it will be entering. Now let us say that these are the blood vessels, okay, these are the blood vessels. Now Amoeba histolytica will travel through the blood and may reach the primary organ which the Amoeba histolytica will reach is the liver. It will reach the liver. Please remember that the primary organ that is attacked by the Amoeba histolytica is the liver. So it reaches the liver, damaging or causing formation of abscesses. There also it will cause the pus formation in severe cases. Here the first organ that will be caused, okay, or attacked by Amoeba histolytica is the liver. Okay, so in such cases we call this as secondary amoebiasis. In such cases we call this as what? We call this as the secondary amoebiasis. We call it as. But apart from this, again, there are chances that leaving the liver, it can also attack the kidneys. Okay, it can also attack what? The kidneys. It can also attack the lungs. Okay, it can also attack the lungs. And rare, of course, in rare cases, it will also attack what? The brain. It will also attack the brain and also the heart. All these important organs in our body can be attacked by what? The Entamoeba histolytica. This we are calling it as what? Secondary amoebiasis. Secondary amoebiasis. This will be causing severe damage to that particular individual. To that particular individual in secondary amoebiasis. So let us keep in mind that this particular Entamoeba histolytica causing amoebiasis, okay, is first attacking the large intestine. It is first attacking the large intestine. From here it attacks the large intestine. But in such cases, what we said, it is just leading to amoebic dysentery. How do you identify amoebic dysentery? The stool will be filled with blood and mucus. But in severe cases, we are calling it as what? Extra-intestinal amoebiasis. Extra-intestinal amoebiasis. Out of the intestine. Okay, it can attack the primary organ is the liver. And not only liver, it can also attack what? The lungs. It can also attack what? The lungs. And then the kidneys and also the heart. Of course, these are the rare organs, and even the brain also, they can be attacked. Okay, even it can attack the brain also. So these are the points that we have to keep in mind regarding the pathogenicity of amoebiasis caused by what? Entamoeba histolytica. Okay, caused by Entamoeba histolytica. Now we will see prophylaxis. We will see prophylaxis for amoebiasis. Prophylaxis is another word for treatment. Or otherwise, we can say that prophylaxis is an action that is taken to prevent that particular disease. Prophylaxis means action or treatment that is taken to prevent that particular disease. So here, the basic things that we should follow to prevent this particular disease called as amoebiasis is using boiled and filtered water for drinking. Using boiled and filtered water for drinking. Why? Because this disease is caused by contaminated water. This disease is caused by contaminated water, which means that Entamoeba histolytica, if it is present in the water, and if a person, okay, drinks that water, then the person will suffer with that disease. So that's why we should go for drinking boiled and filtered water. Okay, we can prevent this disease by drinking boiled and filtered water. And this is very simple and very important thing that we have to do is that we should always wash our hands, okay, before we take our food, because our hands may be coming in contact with the soil, and if that soil contains this particular disease causing pathogen, then there are chances that he or she will be suffering with this disease. So that's why we should always wash our hands. Washing hands, and even before we eat fruits, we should wash the fruits. And even before we cook the vegetables should be washed thoroughly before we cook the vegetables. So here, washing hands, fruits and vegetables is another action that is nothing but prophylaxis to prevent the disease. Action we are taking to prevent this disease. And we know that this disease causing, okay, infective stage of this Entamoeba histolytica is cysts, which are there present in the fecal matter. So the defecation, okay, public places should not be used for defecation. And once this defecation is done in the public places, then there are chances that the flies will be carrying these cysts to the cooked food or cooked packed food materials. So that's why we should always go for what? Using septic tank toilets. So that this particular disease causing pathogen is not exposed on the soil, surface of the soil, where it can be easily carried by the mechanical vectors like flies and cockroaches. And at the same time, once a person is suffering with this particular disease, then it is better to go for using medicines. But before that, a person should also go for what? In their childhood, this is very important, called as what? Immunization. So we have to remember that amoebiasis is having vaccine, and compulsorily everyone should be given vaccines. Vaccination is very important to prevent this disease. This is the primemost thing to prevent disease. Okay, vaccination, which we are going to discuss more clearly about vaccination in the other videos. So vaccination is very important to treat this particular disease, and once a person is suffering with this disease, then he or she must go for using antibiotics, which will destroy that particular pathogen. Antibiotics. Antibiotics such as metronidazole. Okay, antibiotics such as metronidazole and tinidazole are the two best antibiotics which are used against what? Amoebiasis. Ant-amoeba histolytica can be destroyed by using antibiotics such as metronidazole and tinidazole. These are the best medicines which are used in treating this particular disease. So here today we learned about the amoebiasis, pathogenicity and treatment. Pathogenicity and treatment. How it is attacking the digestive system, that is large intestine, and causing blood with mucus stools, and again we have seen how it is also attacking the other organs when it becomes severe. The priormost organ, that is the primary organ that is being attacked, is the liver. Apart from liver, there are also other organs like lungs. There are also kidneys can be damaged. Okay, then also the heart can be damaged, and even the brain also can be damaged. In all these cases, this particular Ant-amoeba histolytica is causing abscesses, pus formation. So we have studied now what is the action that should be taken to prevent this disease, and then we have to go for vaccination and also use medicines if that particular person is suffering with this disease. So let us keep these points in our mind when we talk about the pathogenicity and treatment. Okay, these are the points which we should keep in mind. Thank you so much.